Welcome to Bright Heart Health. My name is John Campy. Today we had the opportunity to sit down with Mothers Against Eating Disorders. They're a group on Facebook with about 3,500 members, and their focus is on education and support of those affected in dealing with eating disorders. They wrote an article about 25 things they wish every treatment center would knew, and I wanted to spend some time understanding the article and their viewpoints on this, and I thought it would be very helpful for other professionals and families and people seeking individual or treatment for eating disorders to hear their viewpoints. So today we sat down with Deborah Schlesinger, Cherie Monarch, and Nancy Clarkson to get more about this article.
So MAED is Mothers Against Eating Disorders, and we started it in 2012. In fact, I was at the EDRS conference when I thought of it. Right now, we have 6 groups. We have the main group, Mothers Against Eating Disorders. We have the advocacy group, the professional group. We have Sacred Space, and then we have the Lost Network. We just started Fathers Against Eating Disorders group, which is FAED. We have a combination of over 3,500 members around the globe.
Wow.
Yes.
Impressive.
Where the moms can come for support and resources, because all of us believe that nobody should walk this journey alone.
Yeah, well, that's great. So then what drove the letter? What's the genesis behind it?
Well, we've been having this conversation, I don't know, for years about what we wish treatment centers knew. And, for years, the moms have been saying, they wish they knew this or knew that or that type of thing. And believe it or not, actually, one of the treatment centers asked us, and actually Nancy and Deb participated in the panel, what we wish treatment centers knew. And so I kind of took that opportunity to kick myself in the rear and actually write down what has been in my head for probably about 5 years that I've been going around and around, and with inspiration from all the mothers. What we wish treatment centers knew, where are the big gaps? Where are the areas that we need to work together? And a lot of the parent support groups out there have been very angry at the treatment centers. They attack them. They're not having conversation. It's more of just, very adversarial, and so I wanted to write this letter in a way that we could all become a cohesive team and collaborate and communicate and write it in a way that, please help me, please help me with my loved one, please teach me these things, please guide me, that kind of way. So it wouldn't come off adversarial. I mean, I knew that, if I wrote something that was attacking, nobody would even read it. It would just go right in the trash can or close. So, that was kind of the thought behind it. And, Deb and Nancy were the first ones to talk about it in the panel. So maybe they want to tell you a little bit about that.
Nancy and I participated at a treatment center. I won't mention any names. There was 5 of us on the panel from MAED. And we had, in the audience, we had lots of professionals from different treatment centers. We had some moms, some family members. And it actually went really, really well. I believe we were able to share our story, what each of us went through on this journey, the very, very difficult journey. I did lose my daughter, so I was able to share my story about Nicole, and the rest of the panel was able to share their journey, which was very difficult. We're all in different places. Some of the children are in recovery, mine is passed, and then we have others that are in the middle of the journey right now. I do believe that the treatment centers were very positive in receiving what we had to say. I think it was very eye-opening for them. We were able to share the lavender letter and read some of it. And I felt that it was very, very important. You know, as Cherie says, in fact, on number 25, it's that communication is the key.
Mhm.
The communication is the key. And as parents, we need to support ourselves. We need to be told what to do when our child comes home from treatment. Like Nancy said, I remember Nancy said, well, you know, you need to help us. Tell us, what are we supposed to do? Just come home and feed our child? We know that doesn't work. So I do feel it was good. I know that we're going to be doing that, you know, so for some more treatment centers. And I know Cherie will be speaking in a couple of weeks down in Florida. So it was positive. I think it was really accepted, very positive. Nancy, what are your thoughts on that?
Oh, I agree everything with what Deb said. Back when my daughter was ill, which you're looking back in 2000, so a long time ago, I didn't know what to do. And, you know, she would go to her weekly therapy and I would hear she's doing good. And then she'd come home and be, you know, the devil himself. She would just, I didn't know what to do. And they tell you, don't be the food police, don't do this, don't do that. Well, by not knowing what to do, we can make it worse. We can make it worse. I gave the eating disorder a very comfortable place to stay for a very long time because I didn't know what to do. I was afraid to confront it because she was so volatile. And what do? You just live in a constant state of numbing fear. And the eating disorder gets more entrenched and more severe as the time goes on. And for 8 years, we were hijacked by it until I finally kind of figured out for myself, I'm not going to put up with this anymore. And I've made some changes. And when I made some changes, things changed. And that's what parents need to know. What in the world do you do when you're laying in bed at night and your daughter comes in your room and starts taking shoes out of your closet and hurling them at you while you're in bed? You can't call a friend and say, oh, guess what happened last night? Because they would say, oh my God, it's crazy town. What do you do when that happens? What do you do? So I thought it was very beneficial. When the other moms were talking, I was looking at the faces of the audience, and shell-shocked is what came to my mind from their faces. Shell-shocked. They had no clue. No clue. There were tears and shock.
Yeah, I think 4 or 5 treatment centers since this letter was published have reached out saying that they're interested in, you know, using this as part of their training or having a conversation about it. It seems, or at least by those 4 or 5, to have been pretty well received. But, you know, I think the thing is it's hopefully starting a conversation, you know, to, you know, have communication between families and treatment centers. You know, when, you know, most of us, what the treatment centers don't often think about is by the time we get to the treatment center, we have literally been through hell. Like, what has happened in our home can't even be put into words because it has been so debilitating. It's like literally like a terrorist has invaded our house, is holding our child captive, has a knife to their throat, and is shouting commands. And that is literally what is happening in our house. You know, so oftentimes, you know, our children will go in treatment and, you know, we're kind of pushed at arm's distance, you know, told to stand back, let everybody manage it. But at the same hand, you have to understand, and I think it's easier when you're a parent of a child, is, okay, you have this child that is medically and mentally compromised. And for you to take your child, and oftentimes it might be a 10 or 11 or 12-year-old child, and drop it off at a treatment center and just basically give them your child and say, please help. But then you're told, hey, you need to stand back. Like, we're going to take this now. I mean, no parent has comfort in being told that. I mean, this is our baby. We birthed them, we've loved them, and we've just been through hell in an effort to save their life. So, you know, telling us to stand back and let someone else take the reins isn't the way to handle it. You know, the way to handle it is to say, you know, we're so glad you're here. You know, thank you for trusting us with your child. We know this is really scary for you. And, you know, how can we make this better? You know, let's work together as a team. Let's communicate. You know, we're going to update you every day or every other day as to how your child is doing, because we know you're sitting at home absolutely traumatized and terrified. Did I just make the biggest mistake of my life handing my child over? Or is my child in a better place and going to get the support that they need? You know, and, you know, I have been told so many things over the years. You know, one thing that I was told that still makes my head spin is that I was enmeshed with my child.
I was told the same thing.
I heard that too.
Yes, it's like, no, I am not enmeshed with my child. Trust me, I did not want to have my 15-year-old, you know, and take her to 7 doctor's appointments a week, you know, go to school and try to feed her, to try to nourish her, to treat her like she's a toddler. This was not on my radar. It was not anything I would ever choose. You know, I'm thinking my child will be on their own by 15, you know, out being with friends and, you know, going to football games and going to proms and, you know, sort of on automatic pilot, and not need me there resuscitating them literally and keeping them alive every moment of every day.
Right.
So enmeshed was not the enmeshed is far from it. It was totally driven out of necessity. You have no other choice. I mean, your child's decompensating right in front of your eyes. Nobody's listening. And, you know, we're fighting insurance companies, doctors, you know, all kinds of practitioners to get them to understand the hell that's happening. And we're, you know, just being driven out of survival. It's literally survival. And, you know, I can tell you that I laid in bed with my daughter at night with my hand on her back to make sure that she was still breathing. Things were that bad. And nobody was listening. The doctors weren't listening. The hospitals weren't listening. You know, somehow oftentimes they manage to put on this face when they're in front of some of the practitioners, like the therapist or whatever, you know, so they just think we're an absolute nut job. But what is happening in our home is literally indescribable. And, you know, I drove my daughter to the hospital with her crying the entire time. Mommy, I don't want to die. I don't want to die. I know I'm dying. Like, you have to save me, Mommy. Like, this is a 15-year-old daughter crying this. Mommy, please save me. And I literally carried her into the hospital because she was paralyzed from malnutrition. She had lost 33% of her body weight, could not walk. So I literally carried her in, and they ran labs. And of course, for anorexia, labs are somewhat okay until they're not. And by the time they're not, you're generally in a critical, you know, life-threatening situation. And they ran labs. They said, yes, she's orthostatic. Yes, her heart rate is 38. Yes, her blood pressure is extremely low, but her labs are normal. So just take her home and go feed her a hamburger. That's what I was told. And I was sent away. And literally at that moment, my daughter's head spun and just looked at me and said, see, Mom, I told you I'm totally fine. And this was the child that went from I'm dying to I'm totally fine. And so enmeshment is not the word. It's survival. It's necessity. It's if you don't do something, you will no longer have your child. And, you know, unfortunately, Deb is here to, you know, she knows that story, you know, when trying to get people to listen and not having people guide you and not having people help you and, you know, more turning you as the problem rather than an asset. And that's the thing. I just want to help. Like, please help me help my child. You know, I don't want to cause any additional difficulty. Teach me what to say, teach me what to do. You know, I know my child best. So just like you're an expert in eating disorder treatment, I'm an expert in my child. You know, I've been a witness to what's happened. I have valuable information. I can tell you what's gone on in our home. So I can give you that information. You give me, you know, information that I need to know, and let's work together to support my child to get to recovery. And that's basically, you know, my perspective, you know, on how this needs to be. And until you've walked this journey with, I remember just thinking, I wish some of the therapists would be in my house to see what is going on. Like, people would not believe what is happening in our home. You know, it's the events that take place are pretty scary.
Yeah.
And well, I'm hogging the whole conversation, so let me go.
No, it's good. It's really
I just
good.
wanted to add a little bit to what Cherie was talking about. I too was, you know, told to, well, a couple things. The first time we went to this psychiatrist in San Francisco who's, you know, worked with eating disorders for 25 years, the first appointment, I'm controlling, I'm enmeshed, and this is the biggest FU to you. Those are his exact words. That was my first appointment. And I'm like, okay, well, why don't you just like dig a hole right now and just, you know, just bury me, because it's obviously my fault. You know, I caused this. And then throughout the years, you know, it was similar with her 10 treatments, you know, she was in treatment 10 times and pretty much got the same. And the one time she was in a psychiatric hospital because she had tried to commit suicide a few times. And the doctor said, you know, I've been doing this. She took me aside. At least he did that. You know, you haven't been doing this for 25 years. And I have to tell you something. You need to go home and live your life and take care of yourself, because she does not want to get better. And those are his exact words. And that was maybe 10 years after the journey. And I'm like, wow, here, you know, another blow. And I didn't say anything. I was in shock. I think I'm at a different place where I would have said something to him. And of course I didn't go home and I didn't leave her. And unfortunately it didn't change the situation. But, you know, I think it's important that treatment centers know how damaged we are also, not just that our kids are damaged, but we suffer, every single one of us here. In fact, all the moms, we all suffer from depression, anxiety, PTSD. I mean, we're scarred. I mean, at least I feel that way. And we need support. We need support. We need support, you know, from obviously personal support, but we need support from the treatment centers. Tell us we're not crazy and it's not our fault.
That's the thing.
It's not our fault. I'm sorry.
It's,
yeah. Yes.
No, I was just going to say, by the time they see us, you have to realize we are not our best. Like, by the time we get to you, we are
crazy.
broken. We are, you know, traumatized.
Mm-hmm.
We are at a complete loss as to what to do. By the time we get to you guys, we are so desperate and so broken and so traumatized that you're just seeing a shell of who we really are. So if we appear like we're anxious and, you know, crazy and frazzled and like, oh, wow, you know, now we see, you know, the pathology because we see the mother. And it's like, no, the mother was not that before. The mother is now crazed because she has just spent, you know.
It's so true.
Yeah, she's just spent years trying to save her child, where, you know, every day is a battle. And it's like, you don't even want to get out of bed because it's like, oh God, I got to start this all over again.
And nobody understands.
Yeah.
Nobody gets it.
Nobody gets it.
Nobody gets it, except if you've walked that journey. No one gets it.
And so like I said, oftentimes we were very accomplished women, professional women that actually had our stuff together. You know, and by the time we get there, we're just like, please, you know what I mean? So, you know, if it started from the very beginning where somebody embraced you and said, you know, I know how hard this has been. I know this is the hardest thing you've ever done in your life. We're here, we're listening, we're going to help you. We're going to help you help your child, and we're going to help your child. We're going to work together as a team. You know what I mean? Like, you can expect to hear from us, you know, every 2 days or whatever about what's happening. You know, if you have concerns, you know, please don't hesitate to reach out. This is the email address you should reach out to, or this is the phone number you should call. And we're here listening. We want to know the history. We want to know what you've experienced, because that will give us insight into your child and will be a starting point. You know, what do you think, if there was a trigger, you know, or there was trauma or an event or something, what do you think, you know, was the cause of that? You know, what have you seen? You know, and it will help everybody, and it will allow the parents to leave there in a state of peace. Yes. Rather than feel like, okay, you know, I'm the bad person. You know, I've clearly done something wrong. I haven't been able to help support my child effectively. So now I'm having to hand him or her off to somebody else because I've done such a horrible job. And that's so oftentimes the way we feel when we leave. And it doesn't have to be that way. I mean, what you're seeing at the time we come is just literally, like I said, a shell of the person we were, because we're so broken and so devastated and so traumatized.
Mm-hmm. And the trauma stays with you, you know, for a very long time, And I think it would have helped me so much if the first thing they told me was, this isn't your fault. Mm-hmm. Let go of that burden right now. This is not your fault. And you know, I can't add much to what Cherie said. It's all true. We've all been there. We've all been told by the professionals. I had one, you know, want to explore my childhood with me and how my mother treated me. And I'm like, you know, at the time I wasn't really focused on that. You know, my childhood was fine. You know, I was a pain in the butt child. Yes, but what's wrong with my child right now? What's wrong? Help me to understand what is going on with her. And don't tell me I'm enmeshed. That makes my head spin too. And I was told that more than one time. And I thought, well, gosh, I'm just trying to keep her alive. You know, what am I supposed to do? And no one ever really told me. Later, we finally found good treatment, and, you know, she was able to recover, but it wasn't enough. It wasn't enough. We are a mess by the time we get them to treatment and we finally get somebody to listen. We're a mess. And like Cherie said, they look at you and go, whoa, wow, she's really a mess. No wonder the child's got problems. Well, we're a mess because of it. We used to be pretty together people, and, you know, and then, you know, as one of the moms said on the panel, I am her mother, not her pathology. Mm-hmm. That's a big difference. We're their mothers. Please understand that. We have been not sleeping and having our lives threatened by our own children. And that's when you're afraid to be alone in your house with your child because you're afraid for your life. That's a stinking way to live. And it was like that for many, many years.
I just wanted to say one thing also that we talked about was self-care. You know, we did talk about that on the panel and how important self-care is. When you're, you know, trying to take care of your child who has an eating disorder. Obviously, if you don't take care of yourself, you're not going to be able to take care of her. And when you are blamed and when you're told you're controlling and you're a mess, you don't feel like you deserve, you know, self-care. You don't deserve to go out and, I don't know, whatever it is, a massage or whatever self-care means for someone. And because of that, myself and a lot of the moms have a lot of physical ailments. Mm-hmm. I mean, Cherie and Nancy, Cherie especially, and all our bodies are, you know, in fight and flight mode, and we're under stress. No matter how long Ed's been gone in our life, for some reason it seems to linger there. And that we are still feeling the remains of this journey. It's very, very difficult. And that's why self-care and support is very, very important.
Mm-hmm. Absolutely.
And I believe the treatment centers should recommend that as well.
I mean, it sounds like from the themes that I read in the article, as well as just listening to you guys, we talk about communication being one of the big ones.
Key.
But also, the key, right? It also seems like it has to start off with just some empathy.
Empathy is critical.
Yeah, like it just seems like it starts off with this sort of judgment or accusatory state, or maybe even there's just this wall, like you're not getting through here. We're not going to include you.
Yeah.
And that immediately would put, I would think, a mother on defenses. I mean, as a father, I would be on defense.
Yeah. No, and that's the thing. And not only does it put the mother and the father on the defensive, but what is the message that it sends to the child?
And the message is sent to Ed. Hey, Ed's happy.
Well, that's the thing. Well, obviously the eating disorder doesn't want the parents to be involved, but the child, it's so important for the child to know that, you know what, your parents have done absolutely everything and have helped you the best way that they know how. Rather than sending the message that, okay, your mom's enmeshed, we need her out of the equation. These are all the problems with your family. So we're going to take you and we're going to separate you from your family and put them out here. And, it's just going to be the two of us. But the problem is once our loved one, whether they're child or adult, leave the treatment center, the place they're coming home to is the family. So that is why it is so critical that the family be part of the equation, that relationships be healed, or that tools be taught, that skills be taught. All families need to be taught how to support their child when they leave the treatment center. A lot of times, they get very effective support in the treatment center, but then they come home and they start stepping down to IOP, or they just come home to the house. And there's no tools. The family haven't been taught any tools. Okay, what do I do if my child comes home and she doesn't eat dinner? Okay, no, I'm not eating dinner tonight. I'm not doing that anymore. I left the treatment center, like that story's done, and we're now doing a new story.
That's so true.
And the parents like, holy shit.
Like, what do we do now?
What do I do now?
Right.
Yeah, and literally, that needs to happen in the treatment center, like the role playing. Let's have the treatment team and the child, and whoever is going to be the support for that child, whether adult or adolescent, and role play that. Let's talk about it and communicate it and anticipate and manage expectations, of what's going to happen, and say it right there in front of the adult child. You know what? You don't go home and you don't eat your dinner and this and that. Your parents are going to do this, and this is how it's going to go, and that kind of thing, rather than this, kind of crack in communication where the child's saying, you know what, my treatment center said, and my treatment team or therapist said, you're not the food police. So you step back.
Yes, that's right.
That's true.
And it's literally what happens. You're sitting there saying,
Exactly.
So that's why the communication is so critical, and communication between everybody, so that expectations are managed, a plan is in place. This is their meal plan. This is what they're supposed to be eating. This is the plan for when they step down to home. These are the things they're supposed to be doing. If they're not doing these things, this is what you need to do. Not just stand back and don't support and don't encourage and, let things decompensate, which happens frequently for families.
And quickly.
That very frequently, that the child is home and literally within a period of 3, 4, 5 weeks, they are at, code red again, because the child's just said pretty much, screw you. There was no plan, no communication. The parents don't know what to do. They're being told step back, let them manage it, So we have to find a way to work together to have the support in place with the child included, so that the expectations are managed. So the child's not like, well, that's not what I was told. That's not what I'm doing. That's not what I believe. I think that's a critical piece. And, to not have cracks in the window, to have a really solid foundation when throughout the treatment process, both in the center and when they come home, you know, that you've looked at every single angle and you have a really solid foundation to start recovery in the environment where the eating disorder existed. And that's the hardest part for them. You know, they're coming home to the very place where the eating disorder existed. It's scary. It's really scary for them, and it's really scary for us. I mean, we're literally want to,
Run away.
Run away.
run away or run in traffic, or just the knots in our stomach. And, you know, what do we do? You know, how do we support them? We've been told that we are the pathology that, you know, so what do we do now? You know, and I think, I honestly believe families are critical. Just like the treatment teams are critical and the providers are critical, the families are critical too, because they're the ones that are left picking up the pieces when the child comes home and decompensates. They're the ones that are trying to resuscitate, trying to save their life. And by then, you know, and it's not a blame situation. By then you've had to move on to the next patient, to the, you know, next person that's at your treatment center, and the families are trying to figure out where to go from here. And, you know, that's why it's just so important to have these conversations and, you know, to work together as a team. And, you know, honestly, there are families that have difficulties and may not be the best support in their child, but they still love their child. You know what I mean? And love them with all their heart. So you need to give them a role in a way that they can support that will be effective and not make them feel like it's their fault that you're in that situation, you know? And just like, yeah, like Debbie said, what did she say? I'm my child's mother, not their pathology.
Yes.
Yeah, I'm her. Yeah, something like
Yeah.
that.
Yeah.
So, you know, that's why these conversations are so critical. You know, I don't believe in you know, there are groups out there that, like I said, attack treatment centers and stuff like that. And that's not going to solve the problem. You know what I mean? Because then we're not working together. We're not a cohesive unit. We're not communicating. How can we work together to, you know, support families, support patients to recovery? Basically, that's the key.
Yeah, it makes sense.
Well said, Cherie.
What?
Yeah,
Go
well
ahead.
Well said.
It seems like too, I mean, as much as this is for the treatment centers and it's in there, it's just as much for the family members, because you can see a lot by how the treatment center acts. And as you said, you're frazzled. So you're going in, and if people are a little bit curt or rude, you sort of just accept it because you were told to go there, or someone recommended it, or you feel like you just need to find help immediately. But what you don't see are the warning signs that say, well, yeah, but this may not be the best care.
Right.
And so that seems like that's always a challenge too, is how to
That
use
is.
that as a litmus test for whether or not you really should be pursuing treatment from the organization.
Well, that's another reason why we've been really trying to get it out to mothers and families is, you know what, like, this is what you should be expecting.
Yeah.
You know what I mean? When you take your child to a treatment center and you're not getting these things and they're not communicating and they're not including you and they're telling you to step back and get out of the picture, and, you know, weeks go by before you receive communication and you're not having family sessions, and, you know, or maybe, you know, there's situations where one person in the family, it's a mom and a dad, and the dad's included in the family sessions, but the mom's not included, and she's not being told why, you know? Like, if things aren't happening that you're not being included and you're not part of the equation, then you need to start re-examining where they are.
Mhm.
And that's that. So it's just as much for, you know, the treatment centers to say, hey, let's work together. These are the areas we need your support, you know, teach us, help us, guide us, as it is for the families to say, hey, you know, if you're not getting any sort of, you know, inclusion in the treatment and you're not part of the equation and you're being told you're the problem and there's no communication and no collaboration, then maybe you need to reanalyze what program your loved one's in.
Yep.
And, you know, so it's definitely was, I know my mindset when I wrote it was for both, absolutely both. Like, this is what you should be expecting. If you're not getting this, then you need to really re-examine where they are, you know?
Well, that concludes our interview with the MAED group, and thanks a lot to Deborah, Cherie, and Nancy for spending time with us today. Hope you found this helpful. Please be on the lookout for additional videos from Bright Heart Health.